Welcome to the, if you don't mind colleagues, we are teeing off now. Thank you. Welcome to the media briefing. We'll take you through the performance information about what the province is doing to fight coronavirus. We have Premier Lubabalo Oscar Mabuyane, who's going to present the main statement. And then we have the MEC for Health, MEC Cindy Sagomba. We have the Head of Department, Dr. Tabile Mbengashe. And we have the leader of the PMU, who will be joining us virtually. So you will be able to engage with her, Dr. Sibongile Zungu. We have Dr. Jagla, Dr. Nozipo Jagla, who will also be able to provide technical details to some of the issues that the Premier will be talking to. So we're doing this to give you access to all government information about work that is being done to fight the virus. So without wasting much time, I would like to invite the Premier to come to the podium, and then we'll take questions later. Thank you.
Thank you very much. Ingathi unhlanganiso pha ngabe uyafuna ububhekele kancinci sisi. Thank you very much, Mr. Squesha, the facilitator of this media briefing. Good morning to MEC Komba, MEC for Health, and Superintendent General, the PMU team that is here, and all the government officials, and special greetings to you colleagues from the media houses. You're welcome once again for our media weekly media briefing. The Provincial Command Council held its recent last meeting and discussed developments in our fight against coronavirus 2019 pandemic in our province. The Provincial Command Council received reports on the work that is done on a daily basis by 4 work streams, namely health, economic recovery, government, business continuity, and communication. The PCC presented its report, its comprehensive report, to the expanded Provincial Command Council. We understand that in the Eastern Cape, in our attempt to deal with this challenge of virus and in mobilizing all sectors, we've got a platform that sits weekly on Sundays at 2, where we invite all political parties represented in our legislature, the legislature itself led by Speaker, and business, the traditional leadership, the religious leadership, the civil society at large, where we come together weekly. We present comprehensive report as provincial government to account to such critical bodies on the work that we're doing. We have done that in this last Sunday again, reporting on the latest development in our fight against this invisible enemy. The expanded Provincial Command Council applauded and appreciated the role that has been played by the Eastern Cape Provincial Command Council on successful representation that we made to National Command Council in relation to delays in the phasing in of the other grades in the basic education system until the projected COVID-19 peak period has subsided. Also on suspension of alcohol sales, which has relieved the burden on trauma cases in our hospitals. Also by actually acceding to reopening the East London Airport, an effort to also open the Mthatha Airport. On proactive initiative to request the President to authorize SIU investigation on all COVID-19 related procurement cases and allegations that we have actually came across in our province. Also on strengthening cooperation between government, traditional leaders, religious leaders, communities and families for adherence to the regulations governing the conduct of funerals. Progress on the establishment of ward-based response teams and the positive response by Eastern Cape-based companies to government calls for assistance with PPE, additional hospital beds, sanitizers, and other essential supplies for frontline staff. This month of July has been a mixed bag of successes and setbacks in our fight against this pandemic. It is a month where we had a steady increase of 2,000 cases per day, but we also had a slow burn rate in the last 2 weeks of this month. It is critical that our communities continue to adhere to the universal protocols of wearing masks, washing hands and social distancing, but more to stay at home. Our forecast is that August is the eye of COVID-19 storm. All of us must buckle up because we are about to have tough times in our lifetime. Siyafuna ke ukuyibethelela lento ba lenyanga kaJuly sibonile njengenyanga esibonise izinto ngezinto ukuxinezelelo osulubonileyo nokukhula kwamanani ngokukhawuleza abantu abasuleleke kule ntsholongwane. Sicela ukubongoza abantu bakuthi okokuba bazame ukuziqhelanisa nokuthobela imiqathango emiselweyo nokuthobela imithetho, ingakumbi ukuncathama kwimigaqo yokuqinisekisa abantu bayazinxiba iimask zabo xa bethe baphumela ngaphandle. Siyabona ukuba bakhona abantu abasahamba nje abangayiboniyo lento sithetha ngayo nabangayiqondiyo. Ngoku kunxitywa kwemask kusemthethweni. Xa ungayinxibanga imask befana ba amapolisa ayakubamba utshutshiswe because uyingxaki, uyirisk kwaba bantu nabo baphaphandle abanye banxibe imask. So sifuna ukuthi wonke umuntu makayiqhele lento yokunxiba imask. Akubolekiswana ngemask. Imask yeyakho, yiyo lento sithe sikhuthaza abantu abasebenzisa i-cloth mask, ezi mask zamalaphu khona ukuze xa ugqibile late uyihlambe ilale yome uvuke uyinxibe. Abantu bahlambe izandla rhoqo kuba isele lona chiza esaqinisekiswe ngalo ingakumbi kulo micimbi yokusanitizer. Abantu banikane umtyhi, abantu bahlala emakhaya. Siyayibona ke le meko yokuhlala emakhaya inzima ingakumbi kweliphondo lethu. Mandiyiphinde ndiyithethe, i-Eastern Cape zange ke ibe nako ncakasana ukuyilandela le migaqo from alert level 5 ngenxa yemeko nesimo sophuhliso swephondo. Uyawukhumbula uba kwangol-alert level 5 sasixakene nabantu abangena bephuma ephondweni kuba bezongcwaba, kuba bezizisa imizimba, iimoto ngeemoto ebezisuka kumanye amaphondo. Abantu bebebheke ezidolophini ngo-level 5 kuba abo bafumana igrant nabo bamkelayo basebenzayo inye indawo yokufumana ukutya kukuba babheke ezidolophini, ingakumbi phaya kwela cala lalisakuba yiTranskei. So siyababongoza ke abantu bakuthi into kokuba bayiqaphele, bayiqonde ingxaki ezana le ntsholongwane nobungozi bale ntsholongwane. Yiyo lento sizama ukubacenga, sibakhuthaza uba khangela nje umtyhi wakho okhethekileyo. So kuya ngokuya wonke umuntu ukuba yimali yakho oyinikwa ngurhulumente ngesibonelelo eseposini, Sokungathi xa ungayanga namhlanje uyawufika ingekho kule vekzayo. Ngoku kugxalathelwana usuya kuba sibone imibono emibi yabantu namhlanje abanga-observe nezo social distances. Abantu abenza ugxalathelwana ngokungathi imali izawuphela. Xa uapruvelwe ngurhulumente imali njengoko bekucwangcisiwe, uza kuyifumana imali yakho ngokolu hlobo beappruvwa ngalo. Ungangayifumani namhlanje, ungayifumana ngomso, ungayifumana kule vekzayo. Khawange ubomi bakho ubuye umva kule meko uzawuzibona uzifaka kuyo. Sabacela ke abantu bakuthi into okokuba noko bangaleqi imali kuba besithi balambile de bathengise ngobomi babo. Imali yabo iyawuhlala ikhona kwaye bazayifumana nangeliphi ixesha abayifuna ngalo. We expect a surge in infections to almost double over the next 6 weeks. This will put our already strained health system under more pressure, particularly on the availability of critical beds. We expect to be out of this eye of the storm in September with a decline in numbers of new cases and lower rates of new infections. October is a month where we expect to see stabilization in daily increases, and this will offer some relief to our pressured health system. As of yesterday, we have 11,952 active cases in our province. More than 60,745 people who have tested positive for this virus have recovered in our province. This marks an 81.8% recovery rate. Sifuna igcinene sisakele ukuba abanye baye bacimba xa kuthethwa ngale recovery ithetha ukuthi ungakuyoyithatha uyifumana uzawuphila. Into esiyibethelelayo into kokuba abantu bayakwazi ukuphila kule ntsholongwane ngokokuba amajoni omzimba alwisane nale ntsholongwane kuba alikho iyeza, alikabikho ichiza lokunyanga le ntsholongwane, and makungagemblishwa ke ngobomi kuba uyawukuyenza le nto ucinga uba uzawuba kwaba baphilayo ngelishwa ube kwaba bangaphiliyo njengoko imeko esiyibona uba baninzi nabantu abaswelekayo. So la manani mahle makhulu kakade besiwazi kwakwi-modeling yethu into yokokuba 80% of our people who would have actually contracted the virus will be asymptomatic, won't need hospitalization, we will survive this virus. And if we are at 81%, that means we are within that kind of modeling that we had in terms of projections that were made by also our scientists. The number of recoveries was greater than the number of active cases in all districts in the province. Nelson Mandela Bay, Buffalo City, OR Tambo, and Christiani contributed significantly to the provincial number of recoveries. I-Alfred Nzo ngokusithethayo inabantu abayi-2,760 abosulelwe ile ntsholongwane. U-2,093 wabo bantu sele uphilile kule ntsholongwane, and iku-0.4 case fatality rate. Ithetha ukuthi amanani okusweleka kwabantu asesezantsi kakhulu. I-Amathole ina 6,746 yabantu abosulelekileyo. I-73 yabo bantu isesibhedlele. Abayi-5,799 baphilile. Loo nto ikunika u-86% recovery rate. Kodwa sinabantu abayi-198 abasele beswelekile. Isinike loo nto u-2.9% we-case fatality rate, which is worrying. That tells you that numbers zabantu abaswelekayo phaya Amathole ziyaxhalabisa. eBuffalo City abantu abosulelekileyo bayi-17,938. I-433 yabo bantu isesibhedlele. I-14,660 yabo bantu iphilile kule ntsholongwane. Isinike u-81.7% recovery rate. kodwa sinabantu abayi-203 asele beswelekile at 1.1 case fatality rate. iChristiani ine-7,044 yabantu abasulelekileyo, 121 yabo bantu isesibhedlele. Abantu abayi-6,166 sebephilile, ngu-87.5% recovery law, kodwa i-204 yabantu iswelekile. That is 2.9 case fatality rate account. iJoe Gqabi inabantu abayi-2,113 yabantu abasulelekileyo njengoba sithetha. Abantu abahlanu kwabo bantu basesibhedlele ngoku. 1,724 yabantu bebesulelekile baphilile kule ntsholongwane. iNelson Mandela ina 19,350 yabantu abosuleleke kule ntsholongwane. I-362 yabo bantu isesibhedlele. I-16,363 yabo has recovered as we speak. Loo nto kuniku-84.6%, but u-578 ubhubhile. U-578 wabantu bakuthi uswelekile, ikunike u-3% we-case fatality rate. I-OR Tambo inabantu abayi-11,388 abasulelekileyo, 143 yabo isesibhedlele. I-9,855 yaba bantu bakwazile ukuyilwa le ntsholongwane ngempumelelo. That is 86.5% recovery rate. But abantu abayi-214 basandulele. That is your 1.9 case fatality rate. iSarah Baartman ina 4,938 ibe nabantu abayi-35 abasesibhedlele, and i-3,474 yabo bantu barecoverishile. That gives you 70%, but abayi-96 babo bantu basandulele at 1.9 case fatality rate. Sibe nee-cases apha ezi-imported. Zii-cases ke zabantu abangakumbe bakwi-border lines bakwazi ufumana iinkonzo zezempilo kumanye amaphondo kuba besondele kumanye amaphondo. Xa efika pha esibhedlele noba sikwelinye iphondo abhalise i-address yakowabo elapha. Xa sele etestiwe laa mntu yaprocesswa laa case, iye ibuyiselwe back e-Eastern Cape as a positive case yase-Eastern Cape. Ezo cases ke kuthiwa zii-imported cases. Kwezo cases sinabantu about 315 yabantu abanjalo, kodwa kwabo bantu i-307 sele iphilile. Sibe nee-pending cases zabantu abayi-1,638. Ibangelwa ke i-system yethu, indlela yokusebenza phakathi kwe-private sector ne-public sector, because ubuya kugqirha, i-GP yakho okanye lo gqirha wakho uzafuna uyokutesta, uyayibona laa form nawe uyigcwaliselwa ngugqirha uba ngotesta botsala igazi xa uyotsala igazi okanye xa uyotesta. Ayiniki iinkcukacha zithe vetshe nge-address yakho njalo njalo. So ezi cases ke zisinika ingxaki kuba xa kuphuma ii-results kwii-laboratories zethu through NICD ziphuma zinabantu abangaqinisekiswayo kakuhle uba baphi, siyayilandela ke lo mcimbi kuqinisekisa uba asinawo umnantsika umtyhi onje ubheka phambili kuba every doctor has got a file ye-patient yakhe. Ngaxeshanye sihlonipha ke obabudlelwane bukagqirha nesigulane sokugcina imfihlo yesigulo somntu, kodwa ingxaki yale ntsholongwane asifuni okokuba igcinwe njengemfihlo kuba xa ikuwe iyakwazi ukosulela abanye abaseca kwakho, ingakumbi xa ungazichazi. So sibethelela kakhulu koogqirha bonke, i-private practitioners, i-private hospitals, that ezi cases siyazinida kuba singurhulumente thina funeka siqinisekise into yokokuba siyabalandela aba bantu bonke. We get into their contacts, we test their contacts, njalo njalo. So ke baninzi ke abantu abahamba kwi-private doctors, siyayikhuthaza naloo mntu othe waya kugqirha xa zibuye results zakhe kuthiwe zi-positive. Suyifihla kuba sinale nto siyibonayo yabantu abazama ukudala umdintsi netyeneba ngale ntsholongwane. Zichaze, xa uzichaza unceda wena, uncede nabo basondeleyo kuwe khona ukuze sikhawulezise ukusondela sizowunqanda lo meko. So siyabamema ngabantu bakuthi kuba kunzima ukujongana nemeko yezigulo kuba kufuneka siyihloniphile imeko yezigulo zabantu, kodwa ke siyabacela abantu bakuthi lonto basincede njengoba siyibethelela lento ethi bonke abantu abanezigulo abanazo ngoku, ingakumbi esisigulo siyi-hypertension, sifike sitshantshele sona kule nto yokukhawulezisa abantu kwento zokuminxana nezifuba nentontoni, ibangela uba abantu sibabone benikezela ngokukhawuleza. Xa uneemeko ezinjalo ngokwezaa zigulo zichaziweyo, sukuyikhuthaza noba ucinga uba unomzi owaneleyo into yokuhlala, yokuzi-isolata, yokuzenza ikheswa endlini yakho, yize esibhedlele kuba ngexesha uzawunida ngalo ukuncedwa okukhawulezileyo kwe-oxygen uza kufumana esibhedlele. I-oxygen ngokwangoku seyilelona chiza likhawulezileyo ukunceda abantu nokunyusa izinga lokokuba abantu bakwazi ukulwa noziphefumlela ngendlela ekhawulezileyo. Kanti ngoku xa ukhona akho mntu uzazi uba i-oxygen iyacutheka emzimbeni wakhe ngoku. Abantu abaninzi ke bafika ezibhedlele sele bengenawuncedakala kuba sele i-oxygen iphumile emzimbeni yabo, kuthi kuzanywa ukuresuscitatwa kulungiswa kube sele konakele. That's why sisithi xa besezibhedlele bayakwazi ukutshekishwa ngokukhawuleza. That's why sivule i-isolation sites ezibhedlele okanye closer to hospitals for constant monitoring. Abantu sibahambele, sibajonge amanesi ethu noogqirha, simonitorishe i-temperature zabo njalo njalo khona ukuze singabenabo abantu asibaluzayo nje ebesinokwazi ukubanceda. Almost all the 11,952 active patients are receiving care in their homes, isolations and quarantine sites. So sithe bhazalala abanye basemakhaya, abanye basezibhedlele kwi-isolation sites, abanye kwi-public sites esizi-identifyile, abanye kwi-quarantine sites njalo njalo. As of yesterday, the number of hospitalized confirmed SARS-CoV-2 cases in both public and private hospitals was about 1,213, with 93 cases as the ICU and 15 in high care. Also, 43 patients were on ventilation, 436 cases were on oxygen, and 1,105 in an isolation ward. There were no patients discharged, and sadly we had 58 inpatients deaths between week 12 and week 26. The majority of the admitted cases were discharged compared to the fewer cases that demised in hospitals. Our overall fertility rate stands at 2.1%, accounting for the unfortunate demise of 1,534 people in our province, as I've tried to speak at length on this above. The concentration of the remaining active cases is in the 100 municipality wards that we have identified as hotspots, areas in the 2 metros and all the district municipalities of our province. Our testing, tracing and rapid response teams are zooming into the 100 municipal wards with health promotion and care services. Ndiyafuna ukuthi kukubabaza nokugqamisa lento ka-100 wards. Phansi yonke i-area ngoku i-hotspot, nomuntu oyi-1 uyi-hotspot, because that person oyi-index uba nokosulela abantu abaninzi xa singakhanga sakwazi ukumnqanda. So phansi xa umamela kwesi state sethu asinayo ngoku i-district less than 1,000 cases, infected cases. So phansi zonke i-district in the Eastern Cape zizi-hotspot, but kuba ezi zinamanani amakhulu sizamane ke sibe ngathi sigqamisa zona. Asifuni ke abanye bayekelela umxakatho ukulwa nale ntsholongwane kuba besithi hayi ngathi thina sisebhetele. Akukho nto ibhetele, le ntsholongwane ikhona, iyaphila kuyo yonke indawo apha e-Eastern Cape ngoku kwii-district zethu, kwaye as long as abantu besajikeleza behamba besiya ezidolophini besenza zonke izinto ngokungathi ubomi babo ngububomi besiqhelo, le ntsholongwane baye beyinika amandla ngakumbi, beyenza iphile ngakumbi, beyenza iqhubeke nokosulela abanye abantu ngobuninzi babo. The concentration of the remaining active cases in the 100 wards that we have identified as hotspots in the 2 metros and district, that's one that I've dealt with. We are also observing that the incidence of COVID-19 cases among the female population is higher than in the male population between the age of 0 and 55, and this changes from the ages of 55 to 80, with more incidence higher in the male population than in females. This is a crucial information that our people should take note of, as it speaks directly to who is in harm's way of this virus. We have identified 5 risk factors we are attending in our fight against this pandemic that might undermine our work if not properly addressed. And these risk factors are the infection and the death of our healthcare workers. 2, non-availability of beds at a particular peak when we would need those beds. Non-availability of oxygen, the ineffective leadership at level of health institutions, and kulona umba sivene ngokuba sizawuyeka into yokuqashwa ko-CEO uyenza into yapha ezantsi ye-district. Every CEO ekuthiwa yi-CEO yesibhedlele umcimbi okuqeshwa kwayo sizawujonga njengokuba sizawu-assessa, sizawukwenza lento ye-skills competence assessment kwaba sele bekhona ukuba are they fit for purpose, because siyabona ukuphasalaka kwezibhedlele ngamanye amaxesha ubone into yokokuba kukhona nje ukuba ngabikho kolawulo oluqinileyo nolawulo oluhesheheshe phaa ezibhedlele. So kubalulekile ke ba siqinise isystem yethu ingakumbi kulaa ndawo isondele ebantwini inenkonzo, so that zonke izibhedlele zethu ziyazi into befanele ziyayenza ngexesha elifanelekileyo. Umsebenzi wesibhedlele ukulawulwa, wonke umuntu alawuleke, abasebenzi basebenze, abacoca isibhedlele bacoca isibhedlele, amanesi anesi izigulane, oogqirha abanyanga izigulane, wonke umuntu ayazi into yokuba esibhedlele xa isiya esibhedlele emsebenzini uyothini. Urhulumente, abaphathi bezibhedlele baqiniseke into yoba abasebenzi bakhuselekile. Zonke izixhobo zokukhusela abasebenzi sithe mazibe khona izibhedlele, yinto yokuqala leyo efuneka siyayenza every day. Xa singena ofisini kukubuza sibhedlele nesibhedlele into yokokuba i-PPE ikhona, i-enough. Asifuni sibe nengxaki yabasebenzi esizawubabona besestratweni kuba bekhalazela i-PPE. Siyafuna ke ngokuyijonga le nto into yokokuba oku kosuleleka kwabasebenzi kungaka ingaba kwenzeka ezibhedlele na okanye kwenzeka ngaphandle ezibhedlele, oku kukhokelela ukuba sibe sibona amanani abo ekhula ngohlobo. We are also looking at this as a very serious risk factor, the inadequate psychosocial support that we have identified. Lesibona anxiety ifiye ebangela ba abantu bonke babe ngama qhitala nabo bebeyazi lento ukusebenza kwaba isetyenzwa njani babonakale besoyika. The project management unity team in the Department of Health that we have just recently established, that is led by Dr. Zungu, is our vehicle to address these risk factors. The team has already developed a comprehensive overall plan to operationalize COVID-19 provincially, district and site-specific management and implementation structures. The plan is anchored on the principles of promoting data-driven decision-making and adhering to 9 strategic objectives outlined by WHO for COVID-19 response. It has 5 essential work streams, which are community health, health system, HR, leadership, psychosocial support, and business continuity. In resourcing the work we are doing in this war, we have actually invested again or allocated additional amount of 2.5 billion from our adjustment budget to the Department of Health. From this budget, 1.6 billion will be spent on the following items. Siyazi ngathi kuthethwa ngezibhiliyoni kukho abantu asebevuzelwa zizingcu. Njengoba senivile into yokuba ingathi sithambane engxaki kule nto yokungaqiniseki kakuhle kule nto. Asivuli umtyhi ngoku ngokokuba kubekho abantu abacinga uba lixesha lokutyeba. Akukho mntu unozamana nofuna ukutyeba ngexesha lemfazwe. Emfazweni silwa imfazwe. Yonke le mali urhulumente ayithetha ngayo nayenza ibe khona yenzelwa ukulwa nentsholongwane nokuhlangula ubomi babantu bakuthi nokunceda indlela urhulumente kufuneka asebenze ngayo nokubuyisela amashishini emsebenzini. Yonke ke le mali sizawuze siyibone umsebenzi wayo kukuba wonke umuntu akwazi uparticipate. Your SMME funeka sahlule ngoku kule nto yokokuba the real SMMEs and nabo bantu bathi bazi SMME kuba bezi transaction dealers or transaction brokers abangenalo ixesha lokwakha i-economy. Le mali must be invested in the economy because zonke ezi services zithetha ngazo must be procured. Xa ziprocurwa, that value chain, that value addition must help us to address the problem ye-economic recovery plan. So le nto ye-corruption siyibeke phantsi kweliso lokhozi. Akho mntu unozathande ehleli nje xa emamela i-Eastern Cape i-corrupt this and that. When we are attending to all these issues and we are committing ourselves that we are going to uproot corruption, we are going to deal with corruption wherever it shows its ugly head. But the process must be followed. Awuzuthi xa kukho umuntu oveke wavuka wabhala kwi-social media etyhola abanye abantu nge-corruption okanye xa kukho i-article sivuke sesithi yi-corruption. Yonke le process siyithe mayenziwe. That's why sibhalele upresident. President sicela usinike i-SIU izosiphandela ezi allegations. We have employed your private forensics to deal with certain issues like in your Department of Transport that were raised. Akukho nenye i-allegation ye-corruption engazutestwa. Izawutestwa, will be investigated, we will deal with it. Asinaze sibe norhulumente we-African National Congress ozawuba ngurhulumente ozawubangelwa umdintsi netyeneba ngenxa yobusela obuxakile. Corruption is endemic. Corruption is endemic. That's why as you go around you would hear people talking about release fees. Wenza umsebenzi karhulumente ubunikwe kakuhle uyi-SMME. For you to be paid, funeka uyobhatala lo muntu uza kubhatala. Kodwa lo muntu uqeshiwe uyabhatala, ubhatalelwa uba makenze umsebenzi wakhe. Kodwa funeka uphinde uyomrhawula ecaleni umbhatala. Asiyikhuthazi ke le nto noosomashishini siyabacela mabahlukane nokunyoba amagosa, mabahlukane nokunyoba ii-politicians. Wonke umuntu makakenze umsebenzi wakhe ke sikline i-system sibambisane apho kukho khona izityholo. Yizani ngaphambili nezityholo ze-corruption nizibeke, urhulumente azilandele sizokwazi uqinisekisa into yokokuba siphila kwi-society right. Ibhlungu into ye-corruption uhleli nje ujikelezwa lilifu elimnyama le-corruption ongayaziyo noba itheni. Kuba thina zi-politicians sothuka i-corruption xa sele iripotwa apha esithubeni kuba awuyazi into ye-supply chain bibiqalele phi yathini, uyawuyiva xa sele iripoti uba kukho ingxaki. Yiyo le nto ndithe uTreasury no-DG wale province, uTreasury makenze our Operation Clean Audit Unit yakwa-Treasury maba-audite zonke ezi transactions zi-COVID related. Siyayazi bu-Auditor General uyayenza loo nto as we speak, but yena umane ebiza nje loo case ithile afuna uyibiza. Thina mazi-auditwe zonke ukuqinisekisa into yokokuba sizazi uba do they stand the test of time. They must stand the test of time. But ibambi xa ubona abantu bakuthi abamnyama benikwa amathuba ngobubanzi babo ngobuninzi babo, loo nto ibe idramwe up as a corrupt system. But xa kunikwe nje abantu abamhlophe abathile inkampani ezinkulu, so you will never hear a lot of these issues. That's a very bad aspect of it. But akukho mntu ulihlobo lowunikwa umsebenzi karhulumente ngendlela engacacanga. So a system must actually be transparent. We are in a democratic, we are in a kind of a constitutional democracy. And it's important that we appreciate transparency, we appreciate accountability, we appreciate responsibility. Everyone who does anything wrong must know that down the line you will be held accountable. I've said that to all HODs, accounting officers, that they must look at blind spots. No one must leave anything to chance because they will be held accountable as accounting officers. We can't keep on with this wrong narrative of corruption and corruption whilst we don't know where is it, how to touch it. Where it has actually been shown, we must deal with it. I'm happy that in cases that have been reported, no government money has been spent. Whether you speak about scooters, which we are currently looking at that particular tender, whether does it stand a test of time, because we need those motorbikes for our primary health care, for distribution of medicine to our people in rural areas, but it cannot be done if the tender is wrong. That's why we're looking at it now. The file is currently with Auditor General, and we are looking at that with keen interest. So it's important that no stone will be left unturned kulento inento kwenza ne-corruption. Kodwa siyacela into okokuba makungabikho ezi fabrications enziwayo ngabantu where people create corruption in their figment of imagination, run narratives ngenjongo zoku embarrassa, ngenjongo zoku trying to stigmatize government of the ANC. So that one, but let's deal with corruption. We know the perception, it's wrong itself. When corruption is perceived or really, it worries. So we're very much concerned about this kind of a narrative that seeks to be dominant. Wonke umuntu nje ofuna uthetha kulula uthetha ayofaka i-Eastern noba ingena indawo ngezinto ze-corruption. Ikhona nje ke into wrong on how people are. Even those who are peddling information in the social media, we are able to follow that and see what is real. Most of them were able to detect that these are fabrication ezakhiwayo. Kodwa siyayazi into okokuba i-corruption i-endemic, it is systemic. We've got to uproot it and we've got to follow it. Every supply chain process must be tested. That's the point that we're trying to make. So we can't leave anything to chance on this one. So, but it's going to be bad that if now government cannot work, every time a big number of people, previously disadvantaged SMMEs, when they are benefiting, that on its own is viewed to be suspicious, is viewed to be corrupt. So there's something wrong with that. But also when government gives people opportunity, some of these people, they've started from nowhere to be big business. You have to look at potential, give people, but support people. Don't give people work with the purpose of trying to collapse them and fail them. And then that comes back. It becomes a negative repercussion back into government's face. So we are looking at all those kind of issues. Treasury is working on that to ensure that we are running a clean campaign, a corruption-free campaign. Where corruption has been detected, it must be attended to, it must be dealt with. All reports, SIU reports when it is done, every investigation when it is done, we're going to call you. We're going to come public and present those reports as we are actually currently investigating them. Of this 1.6 billion, 2.5 billion, 840 million will actually be looking at field hospitals, infrastructure and operating costs, which include maintenance and of quarantine and isolation sites done by the Department of Public Works. 441 million for PPE and consumables. 175 million for 5,400 community health workers. So we've got an issue there. We've seen them complaining around this. We're attending to the matter. Community health workers. It's not an easy matter, I must say. Government is already under pressure on cost of employees, but we're looking at it. We've got a big number, probably compared to others because of the vastness of the province. But they've got a case. They are raising a genuine case. They are doing an extra job. They are critical on our primary health care that we are talking about. So if we can't correct that situation and in whatever way, but it is actually nationally discussed. So there's a national approach on it, which is going to guide all provinces on how to deal with that moving forward. 173 million for ventilators, for 240 ICU beds, 17 million for 171 enrolled nurses and nursing assistants for 12 months in additional to the 822 which was allocated in the emergency funding, and 12 million for incumbent doctors and nurses. As they are here, we are taking responsibility for them. As you would understand, even soldiers, I was made to believe that as they are here in the province, government is taking responsibility in terms of their logistics around the province. I must hasten to add that 325 million is allocated to the Department of Education for the appointment of temporal teachers to replace the 2,278 comorbidity cases that can be affected by COVID-19, and 16 million for mobile connectivity for teachers and pupils prioritizing grade 6 to grade level during the COVID-19 pandemic. This coming week, the PMU team will focus on finalizing EMS scale-up efforts fast-track and monitor human resource recruitment and monitor supply chain activities, especially for equipment, PPE, oxygen, and infrastructure. Government has signed an MOU with a Nelson Mandela University and Rhodes University to provide mentorship and technical assistance support for stock monitoring. This will help us improve the management and the use of our PPE. The hospital cleaning strategy is in place and the rollout has started in Livingston and Dorangiza. The plan is to have a service provider contracted for a period of 6 months, which will clean and train the hospital cleaners, especially on COVID cleaning protocols and waste management protocols. Some of the progress we have made is to have field hospital manager resourced from Clinton Health Access Initiative, the management structure for the Reverend Dr. Ngweni Field Hospital developed, and the triage area planned 300,000 worth of additional equipment donated to the Reverend Dr. Ngweni Field Hospital, a functioning mobile X-ray unit in place, and 8-member support team working with Field Hospital to address infection controls also in place in that field hospital. The health system work stream is tasked to determine hospital bed requirements, clinical care management, drug supply and stock management, hospital clean-up, and to support the management of field hospital sites. In the coming week, the team will be seized with the work of implementing our new hub and spoke service delivery model in the entire province and ICU capacity in the northeastern part of the province, which focus on Mount Frelu, Sikisiki, Matatiele, Alwal North, etc. It will also consolidate and finalize the alternative hospital sites for oxygen and equipment requirements. It will also confirm such capacity requirements based on the active case trend. The team will also monitor progress on the construction of concrete slabs at Butterworth, All Saints, Mpelisweni, and Barnabas, Victoria and Grey Hospital, which should start next week to accommodate the installation of bulk oxygen tanks. The community health work stream is seized with the task of repurposing local municipality jobs into COVID-19 war rooms, training of ward-based rapid response teams, a de-densification of informal settlement, provision of water and sanitation, and monitoring the burial capacity of mortuaries, cemeteries, and crematoria. We want to applaud municipalities that have embraced and that have already established war rooms. I can mention Mpashe, KSD, PSG, Enoch Mgijima, Ndabankulu, and Buffalo City Metro. In the coming week, the integrated psychosocial support service workstream will focus on enhancing capacity building for mental health system by filing vacant posts with the current mental health system across Department of Health. It will also facilitate the recruitment and appointment of unemployed registered counsellors within Eastern Cape to maximize capacity and set up toll-free crisis hotlines for psychosocial interventions. The team will also conduct an awareness campaign in print and electronic media to inform and educate the public about the availability of psychosocial support services we have set up to heal the pain and scars of our people during this time. The HR and leadership work stream has the most critical task in our fight against COVID-19, in that it involves the human capital that must heal patients back to good health. Our healthcare workers are severely exposed to COVID-19 at work, home, and in transit. To date, more than 3,534 healthcare workers have tested positive for the virus, and 56 have lost their lives. May their souls rest in peace. Importantly, what this means is that 3,478 healthcare workers who have tested positive are either fully recovered or are on the road to full recovery, and we will have them back in the health care system soon. We are, however, concerned by the increase in the number of health care workers who test positive, despite our improved efforts of making PPE available to frontline staff. The immediate task of the HR and leadership work stream is to protect the health and safety of health workers, and develop surge capacity for human resource response. Amongst other things, the team will embark on a rapid recruitment of healthcare workers through a shortened 7-day recruitment process, inclusive of special technical skills to enhance capacity, identify the health workforce available to surge capacity demands and essential healthcare services from identified sources, such as the equipment brigade, volunteers, health foreign workforce, final year students, interns and ComServes, SAMHS, NGOs, etc., and determine increased hours for temporal health workforce surge capacity, such as remunerated overtime. Consider redeployment of qualified health professionals from university, nursing colleges, or occupying administrative positions to areas of need, and redeployment of qualified health professionals between provinces through transfer processes. Out of the planned 7,652 posts to be filled through the COVID-19 grant, a total of 6,963, that is 90.1%, have been filled. In the coming week, the HR and leadership work stream will conduct an ongoing training, communication, information sharing with the employees on maintaining occupational health and safety, as well as infection prevention and control at work. The team will also finalize an actionable recruitment plan to focus on the staffing of the VW site and finalize HR delegation to fast-track appointments of potential employees. An analysis of critical leadership vacancies will be conducted, and these will be prioritized for filling. On the government business continuity extreme is entrusted with the task of ensuring that the wheels of government continue to turn and the province and provide services to our people. This pandemic has sadly claimed the lives of 140 public servants, with 4,592 tested positive. Fortunately, many of these colleagues have recovered, and we congratulate them for their recovery. Our departments of health and education are the most affected, with health accounting for 3,244 infections and 54 deaths, and Department of Education 1,143 infections and 69 deaths. To date, 33% of public service employees in the province have returned to work, although this is a fluid milestone. We remain cautious in our approach of returning all workers to work, mainly due to office space limitation and minimize incidence of infection among employees. To mitigate this, we are strengthening digital or e-government programs to enable employees to work remotely and effectively. Government departments are utilizing MS Teams beyond just senior management, and video conferencing facilities are being enhanced across the departments. Communication with our people at this time of COVID-19 continues to be a critical source of creating hope and effecting positive behavioral change. Through our COVID Connect platforms, we are interacting with persons who were tested for virus about their results. More than 50,000 SMS messages were sent to both individuals who tested positive and those who tested negative. The results show that 15,722 received positive results and 34,360 received negative results. And 24%, that is 1,660 of those individuals with positive results, clicked the SMS link, and 21%, that is 1,491, identified themselves. In the coming week, we will produce educational material working with health promotion, community healthcare workers for a public transport forecast campaign. We will also seek to utilize the voice of survivors in our communication platform to encourage infected people. We have seen that one is working is quite effective. Our content will focus on emphasizing the importance of hand washing and use of sanitizer, coughing methods, wearing of masks, lockdown regulation, and handling of bodies of the deceased. In the adjustment budget, which our finance MEC correctly themed getting the Eastern Cape back on its feet. The Department of Economic Development and Environmental Affairs and Tourism was allocated 114 million, and this is a ring fence to unlock potential investment to create jobs at the East London Industrial Zone, Kucha, and for small businesses. The two SEZ in particular are doing phenomenal job of holding on to their existing tenants that employed a combined 10,000 people. The boards of these two SEZs approved the implementation of rental abatement to tenants in the zones as they face low productivity. In additional 75 million has been set aside to help distressed companies, and DID allocated 5 million to the Isikalo Fund to help youth entrepreneurs during this time of great economic difficulties. Over the next month, the DID will focus on supporting more companies in distress to access the allocated additional funding that was announced in the adjusted budget. We remain indebted to private sector partners who continue to extend a humanitarian hand in our fight against this pandemic. This week, I will be accepting PPE and other critical resources from Mercedes-Benz South Africa. Siemens is coming on board with 100 beds in Siciliama, Kiwana. The DBSA is committing to support us with 120 isolation beds. Next week, I will be at Volkswagen in Nelson Mandela Bay to accept another investment of more than 4 million that they are making on PPE and lab facilities to enhance our testing capacity. If there was ever a time where business has actually risen to the occasion in our province, it is during this pandemic. We are in our at the amount of support we are getting from the business. I must add that most of this support is voluntary. It is a patriotic act of the business community. Working together with our social partners, we are fighting this virus with common goal of saving lives. We will guard our cordial relations with the business sector jealously, because beyond the coronavirus pandemic, we must work together to create jobs and fight poverty in our province. This is the same ethos we will invest in our relations with the other key stakeholders, including labor, religious fraternity, as well as civil society. As soon as we realize that there might be an incidence of corruption in COVID-19 related procurement, whether real or perceived, we were the first province to write to the president asking him to institute SIU, as I've indicated. Investigation into the COVID-19 related procurement in our province. We did this solely to fulfill our obligation to the people of our province that we will run a clean administration that is free from stranglehold of corruption. We are eagerly awaiting the arrival of SIU investigators and all departments that are interested in. We will fully cooperate. In the meantime, I've instructed Provincial Treasury to conduct investigations, as I've indicated in terms of Section 18, subsection 2F of the PFMA, in provincial departments on COVID-related procurement leveled against state organs or individuals within the state. We invite members of the public who have information of corruption or wrongdoing to contact Provincial Treasury or the SIU immediately to assist investigators. It is clear that while most of us have sleepless nights trying our best to fight this pandemic, others are having sleepless nights planning to loot scarce state resources that are meant to fight this pandemic. Here in our province, corruption has been an added burden that has hampered the progress of reversing the socio-economic development backlogs for far too long. It will no longer be a defining feature of a brand Eastern Cape. I can assure the people of our province that our provincial administration will not be embroiled in COVID-19 pandemic malfeasance scandal, not any under our watch. We will definitely make sure that we expose any kind of malfeasance that will actually be characterizing this very difficult period that we are going through. Siyabacela ke abantu bakuthi basebenzisane nathi sikwixesha elinzima, ixesha lokokuba singabi nababukeli emfazweni. silwa imfazwe enzima, imfazwe enababukeli abahlelele ugxeka. Zange ndayibona ke imfazwe ebukelwayo. Emfazweni uba necala olwakulo, is either ulwa kwecala labantu, ulwe nentsholongwane, okanye ke wena ulwisana nentsholongwane, uncedisa intsholongwane, ulwe nabantu khona ukuze aba balwa nentsholongwane baluze focus, babe distracted. Asuzuyivumela ke lonto, idabi esinalo yile ntsholongwane, nabanye abazama usitsalela emacaleni besenze ezinye izinto sibajongile. So sisebenza ke ngolo hlobo ukuzinikezela, sifuna wonke umuntu, all civil society, everyone to come on board, help us, work with us, embrace us, correct us where we are doing wrong, so that we can correct ourselves in moving forward. I thank you.